Good morning and welcome to this month's C2S Leaders Lounge. It's our monthly opportunity for leaders to come on digitally, grab a cup of coffee, catch up with other business leaders, but also get some insights into what some of our businesses and business leaders are doing. And we're absolutely delighted this morning to welcome Colin Beard and Josh Isaacs, Directors of Prosperity Care and Wellbeing. And this is a really exciting company. They have been winning awards, and we were absolutely delighted that this year they won the C2S Culture and Diversity Award. Many congratulations to you on that. And for just all of the outstanding work that they're doing. So Prosperity Care and Wellbeing, they offer a diverse range of support services for individuals with health and social care needs. They operate very much around Gloucestershire and also the surrounding counties. And they believe that providing a personalised care service for everyone is part of their focus. And they plan very much around the individuals and not their health diagnosis. They've been rated outstanding by the Care Quality Commission and are doing fantastic things in their business and really exciting plans for further growth. So lovely to have you here today with us. Thank you, Colin and Josh. I'm now going to hand over to you. And after the session, we've got Colin on one table and Josh on the other table. So you're going to have plenty of opportunity to ask them lots of questions. And they're really happy to share and tell you a little bit about how they've achieved this and share some of their ideas with you. So over to you, Colin and Josh. You're going to launch your slides and take us through some things you've been up to. Welcome.
Thank you very much, Angela. Thank you. And thanks everybody for giving your time up this morning to join us today. A really lovely introduction. I just wanted to make one correction there. We were rated good overall by the Care Quality Commission with outstanding in the domain of well-led. Unfortunately, for our first inspection, they felt that there wasn't enough evidence to give outstanding across the board, but we were really happy to get it in the domain of well-led, which shows the kind of commitment to good leadership. And I think that we've got some testimonials from CQC in this slide. So I suppose just to give people a breakdown or kind of an introduction of where we are. So I've worked in the health and social care sector for many years within Gloucestershire, covering different levels, but started off as a support worker 20 odd years ago, and have had the pleasure of working with some really amazing employers and some amazing people that we support, and just really loved and cherished my time within the health and social care sector. I was working for another organisation and really felt that the standards were incredible. I wanted to replicate that and also put my own stamp on and focus on the area of well-being, which is the kind of the clues in the title with the name Prosperity Care and Wellbeing. I think very much this came about from the COVID pandemic was a real springboard into that situation, because apart from nurses and key workers and people within care homes being clapped on their doorstep, which was great, it really kind of started to increase people's presence and awareness of the importance of support workers and care workers. But that never really filtered much past that, and people were still then having to go back into work and work very long hours for very poor amount of money, which is kind of, unfortunately, the care sector. It's a very low investment area. And we believe passionately that people in the care sector requires more care and support than what they were being offered from society in general. So we wanted to focus very much on that. And also, I think the one thing that the pandemic really opened people's eyes to is that health and illness, unfortunately, is non-discriminatory, and it really doesn't matter which class, how much money you've got, how old you are. COVID was getting us all. And I think that was a really kind of good stepping stone to think, well, actually, now we're thinking a bit more about well-being and about anxieties that have been associated with working from home and then coming back into the workplace. It was a real idea that we thought, okay, let's make our services open to everybody. So Joe Bloggs down the road, who is now struggling to get out into the community because he's become a bit agoraphobic or because he's got fears that wouldn't be captured by NHS services. So that program is that our commitment is that any of the activities that we provide are fully inclusive. I think that this was just to kind of give some ideas of the growth that we have had. We are currently providing over 4,000 hours of care and support per week. And when you look at it as hours, that really may not seem so much, but it really is significant. And I think if you turn those hours into outcomes, smiles, achievements, goals, it's a lot of input. And, we're really pleased that that's been recognised by the quality of care that we provide. Just a little statement here as a winner for the Circle to Success Culture and Diversity Award. It's just to say that we were absolutely bursting with pride in that situation. We were up against some really quite significant contenders of people that have been running long-standing businesses, and even just to be kind of in the same room was really well received. But we felt that our culture, which we'll talk about and focus on a lot within the presentation today, is really what we have celebrated and has helped us to achieve some of the testimonials. So I think it's important to talk about with the imposter syndrome that we have. I think it's important to say, okay, rather than it being our opinion, let's look at some of the facts. If we go on to the next slide. So some of the awards, and there is a bit of blowing your own trumpet and feeling uncomfortable around that, but I just wanted to pick some of these apart because I feel that they all come together to create the more of a healthy workplace as it states on the slide. So Inclusivity Works. So that's a scheme. For many of you, you probably know these things. I won't go into too much, but if people do want to know a bit more at the end, then please do get in touch. So Inclusivity Works is a scheme that we have pledged. So we had to go through a testing procedure about looking at our policies and procedures, recruitment processes, and to look at how inclusive they were to get people with disabilities back into work. And we found that we have had a real good success rate from people that are coming in that have got lived experience, who possibly hard of hearing, possibly that they have poor mobility or require long-term times off sick. But when they are sick, we know that we are able to take those out of work and make reasonable adjustments. So they've really brought a sense of commitment and understanding the world of kind of care from a person's perspective. We obviously had the C2S Business Award winner for culture and diversity. So again, being in that business arena rather than just the care arena was great, and it really helped us to network. The Gloucestershire Care Providers Association. So that award is actually this Friday, where we've received confirmation that we're finalists on a couple of awards, but the most prestigious award is Provider of the Year. And again, that is something that if we're considering all care providers within Gloucestershire to even be in the finalist is amazing. The Gloucestershire Business Awards, we won Startup Business of the Year, and then Best Place to Work. And I think all of these things, you'll see that they've got a theme running through them about leadership and investment in staff. And I think that, Best Place to Work has been probably one of our top achievements, because when we're using that in advertisement, people are coming to interviews are saying, so why are you the best place to work? Or they're doing their research to find out why. And it really does give them that kind of pat on the back that when they're with us, they feel like it is the best place to work. And then Healthy Workplace Gloucestershire. This is the kind of framework which I believe underpins everything. So this is like doing an NVQ or GNVQ or some a qualification which requires input, and quite a lot of input to gain that, but it does have to evidence the pledge for our staff. I think that's that kind of covers most of those awards. I won't read all of this slide, but just wanted to kind of the testimonials. So this is from the Care Quality Commission. So the Care Quality Commission do not give compliments very easy, but they stated that they looked for effective leadership and management, and that they assured that that was high quality, that there was a promoted and open, fair culture. Leadership of the service was rated outstanding. This meant the service leadership was exceptional and distinctive. Leaders and the service culture they created drove and improved high-quality person-centred care. Their vision was to enable every person who used the service and staff members to have the opportunities for personal growth, to find people's strengths and celebrate their diversity through empowerment. So that was a really lovely statement to be given, and that now sits on our inspection report and is there for everybody to read, and it really does give it a lovely welcome into our organisation. The next statement is from a member of staff, and this is what it's all about, isn't it? You know, we are all here to support our staff, and if without our staff, our businesses would no longer be. So the staff member just wrote a testimonial about being able to be their authentic self whilst at work, coming in and really feeling as if that they don't need to leave 50% of themselves at home, and that the environment is allowing them to grow both professionally and personally, finding a purpose in their work and having a stronger sense of belonging. Next slide, please.
Do you want me to give you a break, Colin, and put some words in there?
Yes, that's please.
So yeah, when we were talking about culture, and this was quite a useful analogy for us, was got two pots here, one salt, one sugar. They both look the same, they both feel the same. Same touch, you couldn't tell the difference just by look, but the taste is different. And that's what we're talking about when we created Prosperity Care and Wellbeing, was creating something different that felt different to the norm, and really honing in on not just the person that we're supporting, but also the people who are going to work for us. What are the skills that they're bringing to be able to, as that staff member said, bring their whole selves to work, and what do they enjoy most out of life that they can bring into the workplace with us to improve their skills with us. And that was a really important part for us in defining what sort of culture we want to cultivate within our organization, allowing people to express themselves within the confines of professionalism, as always. But we felt this was quite a little funny analogy about that. But yeah, the salt and sugar is definitely something that we talk about a lot when we're talking about culture. I don't know if you want to add anything to that, Colin.
No, just that again, from a staff member's point of view, it's okay us saying that that it feels like it's a different place.
Yeah.
What we have to do for the Care Quality Commission, and I would just suggest that everybody kind of takes this mindset, is that when there are statements like that made, is just ask people to kind of write those things down, because I think it has a twofold approach, is that by writing it down, it kind of makes it happen. Those compliments then are used as evidence to back up our statements, but also it can be fed back to the staff team. So a lot of these things, culture is created by people. That's the reality of it. And I think that if you were to have a compliment given, this feels different because when I walked in today, the receptionist was really cheery and everybody was smiling. or I came in today and I wasn't having such a great day, and it was great that my manager noticed this. I think you take those nuggets of information and you can pass them on, and it really just validates people and really makes them aware that their contributions, skills, and input into the workplace culture is recognized.
I think this is where we have been able to diversify our offering as a business as well, and what we've been able to provide to our full staff team and as an external service, by looking at the individual and what skills they individually have, and even just their hobbies, where we have qualified yoga practitioners, qualified massage therapists, qualified personal trainers within our staff team who are coming to do a particular job for us. But what else can they do using those skills, providing that service to the people that we support and to our staff team, to develop that culture and build those relationships? And that's what we've really strived to work on. And that diversity and inclusion part is that looking at the individual and what can that person bring and what do they want out of a career with us. That kind of takes us on to our approach that we've built the company on around the 8 principles of well-being, and this goes through to our general support plans, but also looking at our learning and development plans for our team members. And this focuses around the 8 principles of well-being: emotional, financial, social, spiritual, occupational, physical, and environmental. It may be that some people don't want to develop in one particular aspect of those principles, but if we can try and identify areas and items that they do want to focus on under, say, financial, say they're having a financial hardship at home, especially the cost of living crisis, what can we as a company do to help them, and what are they looking for support and signposting with? Same as in the environmental, that can be anything from our natural environment through to someone's home environment as well. Do they need assistance in looking for painters and decorators, and do we have those skills within our team as well? So
I think
if fluffy and stuff. Sorry, Colin. Yeah, if you want to chip in.
I was just going to say, I think if we just talk about the financial support, because I think that what we're trying to achieve today is by showing examples of what people can do within their businesses, and I'm sure lots of businesses are doing some of these things. Some of them, Spirex, Sarco, are very, very inspirational in their offerings of their staff, and their well-being packages, and we've been doing quite a lot of work with them. And I think that this collaborative approach about finding out what it is that staff actually want and need is essential. So the financial support, we know that the financial crisis is very, very difficult for staff, and sometimes we really do hear that people that are on the lowest rates for doing the hardest jobs. And we really feel for people, they are telling us very truly that they can't afford to get the petrol, to get the car, to get to the job, to do, what they can. So we've had to look at, including additional monies for traveling to and from work. We've had financial advisors in to sit and talk about how to basically survive the month, but also how to look at making tax efficiencies, if there are any savings, how that they can move that across things like pensions and ISAs. And all of those things together, it's a free service, but it really helps staff to feel valued and listened to, and really, hopefully, make a change for them. We won't go through all of those areas and the principles of well-being today, but I think it's fair to say that with one, it acts in a domino. So those 8 principles of well-being is what is in our logo. It very much has the domino effect. So if one of those go down, then it does impact on the rest of the person. So we have our duty and responsibility to try and offer support in those areas. So looking at the next slide, it's very, very small, actually. I don't know if
Yeah, not sure if people can see that. It was a bit of a trouble getting this on, but we were looking at the 5 main benefits of promoting EDI in the workplace for employees. The benefits, just highlighting some of these, enhanced job satisfaction, increased opportunities for growth, fostering a creativity and innovation within the workplace, improved mental health and well-being, stronger team dynamics. We talk a lot about the benefits as well, but there are also challenges. And what we try and promote and encourage is acceptance and resilience within the team as well, because challenge is a normal part of day-to-day life. And it's understanding that not every day is going to be a fantastic day. You will have a tough day at work. Things may not always go perfectly, but it's how we learn from those. It's how we develop each other and support each other through that. And if you can accept that and move and take that support and learning, that's all about, creating that positive culture within the workplace as well. We do a lot of this within our team in terms of measuring it, especially in our one-to-ones and our supervisions with our staff. Employee satisfaction surveys, the growth that we've seen as a company growing from, our first package of care was in 2021, delivering 50 hours a week, and we're now over to nearly 4,000 hours a week, employing about 180 staff currently. So the growth that we've seen, attributed to what we've talked about previously with the awards, and the culture we've tried to foster within the organisation has done us wonders. We know there are and have been across the country a shortage of care workers within this industry. Touch wood, it's not something we have seen a huge problem with ourselves currently, and our staff turnover rates are extremely low, which reflects well on everything we've just discussed. Anything else you want to add on this one, Colin?
Yeah, I think just touching base. So I'm just leaning forward just to read that. I think what we really have found is by having that bottoms up approach. I may have jumped a slide here, so I'll if I repeat,
I can move on if you want.
No, I was just gonna say, I think that the bottom up approach, where we are speaking to the staff team and really getting that good engagement, has helped the company to grow no end. So rather than a dictatorship, we talk to the people that we support and the staff, and we are just enablers of ideas. And I think that is very much how the staff have felt valued and what they've said, because they are on the floor, they are doing the care and support, they have got lots and lots of ideas. Where we have reinvested back into the organisation, we've been able to do things like purchase a vehicle to be able to take people on activities. Now that sounds really basic, but transport and travel for people with disabilities is really difficult. We know that taxis aren't equipped, bus services aren't reliable, and you can't get out and about. So we've invested in vehicles. We've listened to the staff, and they've come up with ideas. One of the best was opening a nightclub for people with disabilities to go out until 2 o'clock in the morning and have fun, get drunk, make friends, do everything that everybody else does. And it started off as an idea just over 2 years ago. It's since gone from strength to strength. There's 200 plus people that come every month. It's been on the BBC News, it's been on ITV, and it is a real sense of group activities, social inclusion, and you just see that people are coming together as friends. Not necessarily involving staff. They will arrive together as their own groups and organise transport. And I just think that has the impact of that is from listening to that one staff member's idea has raised the profile of the business no end. And I think it is those little things. It's about allowing each person's journey to have a big part. And when we're thinking about the inclusion and the diversity of that, it's the diversity of thought that is most valued. I think, we absolutely shy away from that kind of dictator, this is what we're doing, to getting everybody together through every level of the business. And I really feel that makes a huge difference, because people from diverse backgrounds have diverse ideas, and, that's what we want to promote. Just following through on the benefits to the business, I just kind of said that is about the innovation and creativity. Being a new business owner, that's something I've really enjoyed is having that autonomy to be able to go with ideas, throw some at the wall, some will stick, some won't.
Yeah.
Increased employee engagement and productivity. Obviously, if staff are happier, they stay longer, they work harder. It kind of goes without saying. And the enhanced reputation and attraction of talent. I've already alluded to that if staff feel valued, they put us up for the best place to work. If staff genuinely feel that and advocate that, then that speaks volumes for the business and enables the business to attract the top talent. And so we do always have strong candidates for positions. I think Angela's coming in, which shows it's kind of time to wrap up.
I think what I'll move on to
gentle nudge, just very to move along, because obviously some of the value is also around people getting to talk to you guys as well, and ask some of their questions. So I'm not booting you off just yet, but it's
that's fine. Yeah. So I suppose the top tips that we have thought about, and Josh alluded to it earlier, is promoting EDI and a positive workplace culture is bloody hard work. And I wanted to put that in there because it really is. It's one of the biggest challenges, and I find it very much part of my role. And I think that it only takes one person new to join an office and the whole dynamics can change overnight. Or it could be somebody's personal life that, you know, they've had an argument with their partner or that their relationship split up, and that just is allowed to linger in the office for too long. And it can have that impact. There's also
sorry, Colin, if I just to chip in with my bit here around managing our culture. Like as Colin said, it is hard work and it does stem from us, and as the organization grows, how we recruit people who are going to carry on that culture, because as the organization gets bigger and bigger, we cannot be as available and as on the front line as we used to. So we have to put our trust and our empowerment in the people that we recruit. And that's all based on the values. And our interviews and our whole recruitment process is very heavily focused on the values of the company. We've got 6 values that are on our website. And we really hone in on those when we're recruiting for our team, just to make sure that when we are recruiting, we know we're bringing in someone. It doesn't always work. People, an interview is a snapshot in time, but it is hard work to keep on top of. It's one of our daily challenges. And people's experience of culture is different wherever they go, and what they see as a positive culture and a diverse culture may not be on the same wavelength as what we're offering.
So we'll just go to the last slide, Josh, with the how we can help, because I think that as a wellbeing organisation, like I've said, is that we do lots of work externally. So we work with Gloucestershire County Council, we work with a number of other care companies, we work with business and have done some workshops for across industry. And I think this is kind of where we wanted to get to, is to, as I said at the beginning, is not just people in care that require a bit of TLC. So we've got a team of wellbeing gurus that they offer support with diet, nutrition, stress management. We hold classes for different people, so whether that be parents, we have a women's group around menopause, and it means that it's just really being, I suppose, a service that other companies can farm out. Sometimes people do not have the infrastructure that we have, or the specialism or areas there, and they think, I've got a menopause policy, but I'm not actually sure how to bring that alive. And we can come in and support with that, and hold the groups so that it goes from being a policy and a procedure to being something that's meaningful and valuable. And I think even if when our massage therapists go out, they can go into just a room in an office and give each member of staff 30 minutes of breakout time, and again, that means much more than talking just about mental health and well-being. It's showing that commitment and showing that there is an investment. I think that's it. And
That's
if
it.
you
We're done.
You want to stop sharing your slides and then we'll come back together. Thank you so much, guys. That's just, so many valuable points in that. And actually, I'll share your details with the National Women's Leadership Group. Earlier in the week, we had 60 women on there talking about menopause and the menopause strategy, and getting people to be more confident to talk about it and to share, and people absolutely love that. So I'll share your details into that group.
Yes, please do. Yeah,
people are looking at ways to, it's okay to have a good idea, but you've got to move it forward, haven't you?
Yes,
you've got to action it, and you've got to get momentum, and then you've got to keep it going. And I think you made some really, really valid points and some real honesty in there as well. So what we're going to do is we're going to go back to the tables, and Colin and Josh will go on their separate tables. And that's an opportunity for you also to perhaps share some of the things that are happening in your business, some of the challenges that you might be having as business leaders, and actually how do you overcome those, and the opportunity to talk to Josh and Colin a bit more in depth around some of the things that they're doing. Very exciting news recently, and they've got further challenges with change and integrating different cultures and people again. So some really interesting conversations. So we'll see you back on the tables and carry on the conversation. Thank you so much. Thank you, Josh.
Thank you
very much.
Thank you.
Let's go back on the tables. See you on the other side. Hello, it's me again. I just wanted to wrap up this morning and just say a huge thank you to Colin and Josh. They've very kindly offered to share their slides, so we'll be sharing those with you afterwards, and they're really happy to carry on the conversation. So if you'd like to speak to them and dig a bit deeper into some of the things that they've been doing, then they'll be happy to carry on that conversation with you, and some of the well-being that they offer as well might be of interest to you and your people. So thank you so much for joining us this morning. Our entries for the C2S Business Awards 2024 open next week. We've got lots of new categories. Most of our sponsors from last year have already confirmed that they are sponsoring again next year. So please do have a look, and we would love you all to enter one of our awards and be part of that journey. And I think Josh and Colin said earlier how and what a positive impact it's had on their business. So hopefully you'll have a look at that and maybe share it with some of the companies you know. So thank you so much for joining us. Hopefully some of you might come to Cheese Club on Friday. So we're back at the Hotel de Van with our quarterly Cheese Club in-person event, and we have lots more exciting events coming up. So please do have a look. Have a fantastic rest of the week. Thank you so much, Josh and Colin, and we'll see you again very soon. Thank you. Bye-bye.